All right, so you're all welcome again. Today we want to look at Epi Info. Epi Info is one of the data analysis tools that many people do not know, although it is very popular in the health industry. So today we are going to see how this can help us since health analytics spans across every industry. We want to, this can come as a refresher for those who already know Epi Info, or something new and something maybe to explore for those who do not know, so that we can be able to analyze data for the health experts who want to use Epi Info. Many health researchers prefer to use Epi Info in analyzing their data. All right, so just to ensure that we are recording. All right. Okay. So Epi Info is a free statistical software developed by the US Centers for Disease Control and Prevention. So free mean that we don't pay any charge. I think most statistical software packages are free, except Power BI. Power BI desktop is free, but when you want to get to Power BI service, you have to subscribe. I think the other ones are free. R is free. Python is free. Then SPSS is not free. SPSS is a purchase once, one-time purchase. Then I think Stata too is a one-time purchase. So that's that. So Epi Info is one of those, and it is used primarily for epidemiological data collection, analysis, and visualization, especially in public health research and field investigations. So Epi Info is more of a specialized software. Yeah, it's more of a specialized software for health research, and not any kind of health research, but for epidemiology. Epidemiology is the study of disease outbreaks and outcomes. For example, COVID-19. When COVID-19, the outbreak of COVID-19 had to wake up epidemiologists around the world to start work immediately. And the Epi Info is one of those software, one of those data analysis tools that is used for epidemiological data collection. As you can see on the next slide, it is used for epidemiological surveillance. Yeah. So to track a disease, right? For example, I gave COVID-19. We also have Ebola. Those are public health outbreaks. Those are disease outbreaks in the public health that can be tracked. Number of people infected, number of people recovered, number of people who died, and that can be tracked at real time. So Epi Info can be used to do that. When COVID-19 was out, we could go online, and there was a tool online that you could just click on it, and it will tell you the exact number of persons infected for that day, number recovered, and number died. Yes, some of that data is collected primarily by health experts around the world, and Epi Info can be one of those tools that can be used to collect data, and it is synchronized online and then can be visualized and then directly linked to a website where you can go and get the result. So Epi Info is also used in data collection. This is one of the advantages of Epi Info over other softwares. You can't possibly use SPSS to collect your data unless you can use it to enter your data. But to say you want to design a form from SPSS or Python or Power BI, it's a bit difficult. But with Epi Info, you can design a form just like a Google form, just like a Kobo form. For those of us who use Kobo or Google Forms, you can design a form like that in Epi Info. And then Epi Info has a mobile version. Yes, and the mobile version is it's used primarily for data collection. So you can design a data collection form in Epi Info desktop, and then you download the setup and you install in mobile phones. And so those mobile phones can then be used to collect data. And then once you're online, data can be synchronized, and you at the back end with your desktop, you can get that data online and then you begin to analyze. Then Epi Info is used for statistical analysis as well, of course. All the frequencies that you want to do, all the chi-square, all the statistical tests, the t-test that you want to do, you can do that using Epi Info. Epi Info can also be used for data management and export. Yes, even in your finance, if you're a finance person, you can use Epi Info to manage your data. Also, although it is primarily for health, you can still structure it to capture your finance data or your health data, number of patients who come in, number of patients who went to the laboratory, number of patients who were admitted, number of discharge, number who were prescribed medication and they went home. You can track that on a daily basis. So you can use Epi Info as a register. That's what we're trying to say here, data management. So you can track that with Epi Info as well. And of course, you can use Epi Info in monitoring and evaluation. You can use it to design your data collection tools so that those who are in the field can actually collect data. As we've said before, they can collect data and send to you through Epi Info, and you as the M&A officer at your end, you can get it and then you begin to work on your analysis. You can also use Epi Info to build your KPIs, right? Key performance indicators. And once the data comes in, you begin to track. And of course, you can produce charts with Epi Info, just like you do with SPSS and Excel. You can produce those charts, and when data comes in, you can update your data, and the charts will also update, and you can use that to track your project. So it can be used in monitoring and evaluation. Right. So I've explained outbreak investigation, for example, COVID-19, Ebola, malaria, cholera. Those are diseases that actually we used to have outbreaks of cholera sometimes in Cameroon, in some particular regions. So you can use Epi Info to track that as an epidemiologist. Then for survey, I've talked about designing forms. You can also use it to plot map to do maps, right? For geographic mapping. If you have the coordinates, for example, I mentioned of cholera, outbreak of cholera in some parts of Cameroon. If there's an epidemiologist, for example, in one of those areas, they can design a tool in Epi Info where you can collect the coordinates. You can collect the latitude and longitude of those areas. And then with Epi Info, you can actually create a map to show where the disease outbreak is, which is very important, and it should be, because you cannot talk about a disease outbreak without situating it to a particular area. And if you are situating to a particular area, it is important for you to get a map so you can use Epi Info for that. There are other softwares that are good for geographic mapping, like ArcGIS. I think most of us know about ArcGIS. They are good, but Epi Info is a primary one. You could also use Excel, but maybe Excel is limited. And of course, you can also use Power BI for mapping. Of course, health research, that's the primary goal for Epi Info. Right. So how do you download Epi Info? You download Epi Info by going to the CDC website. As you can see, these are the various stages to download and install Epi Info. So you go to the CDC website. Let's copy the website. cdc.gov Epi Info. Let's copy the website. And maybe I can open a browser. All right, so we can open a Google browser and I paste the website and then we search it. Okay. So when we search that, we see that due to Donald Trump's policies, CDC support, Epi Info support will be ended on the 30th of September. Yeah, you can read that. Trump is doing some reforms in the US, and since this is a software produced by US, they used to give support, just like Microsoft used to do. Microsoft can support, when you have challenges, you can get to Microsoft if you have Windows Office in your computer. So you just scroll down, you see Epi Info for Windows, right? This is it here. We have Epi Info for web. You can explore that. So for Epi Info for Windows, I think you can just click on it. you can see my cursor. You click on Epi Info for Windows, and then it opens here, and you can download it. You see, download Epi Info. It's a zip file, not that large. With 100 megabytes, you can download it. So you download it. I already downloaded. Where download it, you just have to run it. So if I go to where I downloaded the Epi Info and stored, you can see the file right there. All right, let me see. All right, so if you look, you'll see this when you download, you have to appear under downloads as a zip file, a Info 7. That's the version we have that's the latest version now. So what you do is you have to extract this. When you open, you have the Info, the packages. These are the packages here, and this is the launcher. So when you extract, you can of course highlight, and I think you just have to double click. Of course, I already extracted. That's why it's opening. Normally, when you open a zip folder, has any normal zip folder, you should be able to extract. So when I extracted, I have the folder here, as you can see on the left. So this is a folder. Once you open it, you see whatever is there, which is what you saw in the zip folder. And we have two stuff here. We have a folder called Epi Info 7, which has some some stuff, right? Some packages that you can use. It has some stuff, some data that you can use to practice and many other things. So you just leave that one, and then you can click on the launch Epi Info 7. If you double click this one, you're going to launch Epi Info 7. Maybe you cannot see that if it's a new screen. All right. So when you launch it, this is what you have. Yeah, this is how the screen appears. You have create forms, you have enter data, create maps, start card, classic, and then visual dashboard. All right, so that's how you install Epi Info. Let us go back to our PowerPoint. All right. So here, the next thing is how do you use Epi Info? You can create a data entry form as I said earlier. You can create a data entry form, and then you can do data entry using that form. Of course, you can do data analysis. So today we'll just look at how to create a form and maybe enter some data. And then next time we can look at how to analyze, but you can always explore from here. As I always say, and which is of course a truth, something that is difficult is what you don't know. I'm sure if someone has ever heard about Epi Info, it's like it is one very powerful, difficult software. But once you get the knowledge like this, you will see that it is not that difficult. It is very easy. And of course, we are in a world where knowledge and information is so present among us. So you wouldn't have a problem if you can download it. You can always search online for anything you want. All right, so let me share the screen and let us see one or two things. If you've ever used Microsoft Access to build, if you ever built a database using Microsoft Access, just know that it will be very easy for you to build a form using Epi Info because it is similar to Microsoft Access. All right, so we are here, and if you want to create a form, you say create surveys or questionnaires with field validation and skip logic. If you've built a form in Como, you see all of this. Do you want to put it at compulsory? Do you want to skip it? If yes, then can this person skip this question and things like that? So if you click on create forms, I don't know if the particular screen is what is showing. Okay, means I have to keep sharing the different screens. When you click on create forms, you have this one that will show. Okay. So what you do is you can take a blank project. You can create a blank project. Okay, but I already started one. But let me just click on blank project so that you see how it goes. You can double click on blank project. I can give it a name. You can give it a name here. You must give it a name, of course. You cannot create a form that does not have a name. So when you give it a name, you click on OK, and then you have a blank form, right? So let me open the one that I I started working on today. I'll come up here to open project. And when I click open project, you'll see all the projects that are in Epi Info, including the one that you've created. So the one I created was diabetes survey. All these other ones, cholera, community health assessment, E. coli, Hansen's disease, HIV, these are already created data that you can use to practice. So this is one I created. I just changed that name to data diabetes survey. So if I click on it, this is the particulars form. I click on it again and open. And once it is opened, you will see the form. So I began creating this. Very easy. If you want to create a name, you already know that name is text. So you simply drag text from here. You put it here. And then you give it a name. And then you choose however you want it to be here. You want it to be a required field that everyone must fill it. If you choose read only, know that nobody will be able to enter data in it. So read only may only be for maybe labels and maybe guides. Okay. So you choose name. For sex, this is male and female, which is option, right? So you come here. It's similar to Google Form. If you have used Google Form, this is very easy. So for sex, I choose multiple. If I come down, if I come here, you'll see. Let's look at it together. Number, phone number, date, time, checkbox, option, right? So if I take option and put it here, I can give it a name. Maybe this time around, let's say religion, since we always have to begin with demographic data, depending on your research. Maybe this one is not necessary. Religion, and say number of choice is up to 2. I can increase this to 3 if I want to put 3. When I increase, you see that these lines here increase, right? If I reduce, they will reduce as well. So I can increase to 3, and then I say, okay, the first religion that I want to put is Christianity. If we're in Africa, we have Christianity, we have Islam, and then maybe we can just put others, right? So these are the 2 major religions in Africa. Maybe traditional stuff, we can put them under others. And then we click OK, and it appears here. Can you see that? So you can arrange it. This is how exactly how your form will appear when you're filling it online. You see these things like this. So you can choose to put it anywhere you want. Like I came here, and for sex, I put it here. Date of birth is I chose dates. All right. So if you want to maybe date of disease commence, the day the person started or got symptoms of diabetes or symptoms of high sugar level, you can choose dates. If you come here, you see dates. You can just drag the date and put it here. All right. And what's the question? You can say, what do you call it in the hospital, Madam Beatrice? Date of symptoms or what? I've forgotten that stuff. It's been long. Like the day the disease began. So you can put it there, and you can make it required. Read only no. You can make it required and just take okay. Then you can maybe want to put it, you just arrange it. Maybe you want to put it here. All right. So this is the label. It's just similar to if you have used Microsoft Access before. This is really similar to that. Okay. All right. So we can put it here. Maybe a little bit down. Then, all right, something like that. The date of symptoms, right? Then we have phone number. We have date of birth. Maybe one other thing. Maybe we can choose another one. What again do we have here? You can even put image. You can snap the picture of maybe a burnt house or something, or cholera disease, anything. Time, you can put the time, number, phone number is even here. Then multi-line text, you can choose text whether it should be uppercase. Maybe the name here, we should have chosen uppercase, right? Because some convention says you should always write people's names uppercase. So I can right click and delete name. Then I come here and choose uppercase. I bring it back and I give it name. Since name may be a keyword in Epi Info, we can just write name of maybe patient, right? Then we take required and take okay. So this name will always appear in caps because we have chosen the text that is caps, all right? So, all right. This particular one doesn't want to align. So you can still put it down. You can still arrange it, maybe something, maybe like this would be better, right? Yeah, you can arrange it like this. So this one is a bit it's a bit heady because you should be able to see these cross arrows if you want to carry it. It doesn't seem to have that. So no big deal. So this is how you design your form, okay? You design based on your questions you want to ask. You create all those questions, all of them. It's a big canvas. You can put all the questions you want to put, and you can even do sub forms, right? You can do sub forms. So we're just beginning and we'll see how this goes. So when you're done, I think it should be saved already. So you can close it. You can close the project. But this for just to enter your data, it's just to create your form. You can't enter data here. If you want to enter data, you have to go to enter data. So you can close project, closing project. So we've closed the project. You can close this page. Can close this page. All right. And then we come back here. When we are back here, you can now enter your data. All right. So you come to enter data. We are now here. You click on it. It's going to open. So I need to share that screen as well. So when you click on enter data, you have this screen. Now you're entering data on a form that you already built. You can't enter data directly in Epi Info. So you must come to open form, as you can see here, and then you go to browse. And then when you go to browse, it will take you to that particular folder that has all the data sets, and you choose the one that you created, which was diabetes survey, right? That's what we created. So you click on it, you take open, and you go create more forms, like I said. So you want to open this particular form, you click on it, and you take open. So it opens, and you take OK. All right, so this is exactly what we created, right? This is exactly what we created. Where are we? Am I sharing that screen? Yeah. So let us try putting some data. Let's just remove all of this. So let's say you want to start this data. Your first patient comes in. Maybe your first patient is John Doe. You see, if I even put, I'm typing and my keyboard is in lowercase, but it all appears in uppercase. Why? Because we chose uppercase when we were building this particular name of patient. John Doe is a May. You can choose May. Date of birth, you can navigate. Since we chose dates, automatically it'll give you a calendar, all right? So you can choose maybe 1990. I can come here, I choose 1990. Maybe I choose the month, I choose the date, all right? Perfect, yeah, PS. Phone number, maybe I can just write any phone number, any number. Maybe it's the patient's number. Religion, maybe it's Christian. And the day the symptoms started, maybe the symptoms started 2 days ago. That's the 15th of June, okay? Voila. Once you're done with this, what do? You go to next or new record. Once you click, look up here. Once you click new record, this one is already saved. A new record comes in. So you can fill as many as possible. All right. Let's say the next person is Maria, maybe Goretti, female, maybe born in maybe 1979. So just click here, click again, then we go to the section that has 19, no, 18 already. So 19, 79 is here, just 79, maybe born in December, maybe 13, all right. Phone number, maybe, if I click, if I type, if I click, let me say on F, it won't take anything because we chose number when we are creating the form. So it takes only numbers, all right. Maybe this is a Muslim. Maybe the symptoms began yesterday, 16, okay. You go to new record, next person, maybe Desmond, Jonathan, let me just write male, date of birth, maybe this is a child, maybe you were just born in January 2025, January 8th, yeah. Phone number is of the parent, if the child doesn't have a phone number, right? Maybe it's the others, symptoms, maybe began today, 17, right? We go to new record. So you just enter like that. So when you're done, you can close this particular data entry. This is just for data entry, not analysis, okay? So if you close it, you say, do you want to save changes? You say yes, you save it, and then you go back to Epi Info, all right? We're here, and all right, we're here, and once you're here, you can go to classic, all right? So this one is to calculate your sample size. Those who do epidemiology, calculate your sample size, calculate your power size, all those things in statistics, right? You can do that here. So if you want to analyze data, you can come to classic. So for now, I'll just show us the data. When I show us, then that'll be all for today. Then some other time, maybe next month, we'll see what to do. But you can explore it. So once I open that one, it's a new window that opens. That window, this is the window that opens. Sure, you can see that. Right. So this window opens. And now, if you want to see the data that you had entered, I think it's not even possible, but you can do some few calculations because you come to read. You need to read it first. When you come to read, as you can see, we'll browse to choose the data that you had, the data that you were putting in. Where is it? Epi Info. Yes, it should be under Epi Info 7. Projects, right? It was under projects, right? Then data diabetes survey, all right? So you open it and then you open a particular form. Voila. When you open it, it's okay. It says this is the path. And then if you open the form, what if I click on tables? Will it give us tables? And what next? What does it want? Because okay is still blue, right? So click on form 1, take okay. All right, it says deleted. Okay, this has been launched. Record count 3. We entered 3, right? Then deleted record excluded. So if you have deleted any form when entering your data, that one will be excluded, and it gives us the time that I've loaded it. June 17, 2025, 8:35 p.m. So with AP Info is a bit tricky because you may not see that data as you see it in Excel or in SPSS. But let's try one analysis, okay? Let's try one thing and see if it's gonna work. So let's try frequencies. And AP Info is very easy, just drag and drop it. So if I drag frequencies and put here, all right, I can just click on it, and it asks me frequency of what? I just click here. This is similar to starter, but also I've used starter too. You can just do stuff like this. So frequency of since we already imported that data, all we are going to have here are the various fields or the various variables. So let's take maybe frequency of sex, right? Yeah, frequency of sex. Yeah, I chose that. Stratified by, this is what if you want to aggregate sex, maybe by religion or by, yeah, say something categorical too, right? Maybe, okay, let's just do sex for now. Stratified by nothing. Frequency of sex, let us see. I think okay. And boom, we have our first result, okay? So the first sex, so he had coded it for us because we chose male and female, but we are seeing 0 and 1 here. So he had coded it for us. We had two males, right? John and John Doe and Desmond, right? So we have two of them. This is a percentage. And then we had one female. So with time, we'll see how to change this so that it gives us the very actual name, male and female. So let's try one other thing. Which data? Okay, phone numbers. Okay, phone numbers. Maybe graph. Now let's to do how do we call it again? Histogram. Histogram is for continuous data, right? But we didn't have something like that. Do we have each? All right, so let us try that and see. Do we have histogram here? It should be frequencies, graph. All right. So you can do linear regression. A lot of stuff here. So maybe histogram is under graph. Do we have graphs? Yeah. So let us see. Graph of so you see when I click on it, it asks me the type of graph, right? So bar, let's choose bar. Title, maybe we leave it like that. Dependent axis. Let's just choose a main variable. Let's just say we want it for maybe date of birth. I don't know. Let's just do some funny stuff. Okay. What did I say? Graph, date of birth, not possible. I can't see anything here. Let me take this down. All right, let's choose something else. Graph for maybe religion. Then we'll choose bar.